Hello, everyone, and welcome to RMD All Things Aesthetics and Wellness Podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombieski, nurse practitioner here at Revitalize MD, and today we have a couple other people with us.
We'll let them introduce themselves, or at least say a little bit more about themselves. This is Mark, and Mark is with Enlarged.
Yeah, thank y'all for having me, by the way. I really appreciate it. Finally getting to do this we've been talking about for a while.
I know. Well, thanks for coming in and spending the afternoon with us.
Happy to.
Yeah.
But like y'all said, I'm Mark with InMode. I actually sell the Morpheus platform across Tennessee. So Dr. Durst asked me to come by and kind of talk a little bit about what they've been doing, what they're seeing, results, success stories. So I thought it'd be a good time for us to go over all that.
So InMode is one of our a fabulous laser company that sells all kinds of different platforms, and RF Microneedling is the Morpheus that we're talking about, but they have all kinds of platforms and different services and treatments, and we'll go into Morpheus specifically today, but we also have Marissa.
Hello.
With us.
I'm Marissa Staten. I'm here to talk to you about Morpheus too.
We're all here.
We're all here.
And we actually have the machine with us. The laser is over here on the edge of the table, so everyone can kind of see what it looks like when we're talking about it, so you get a visual with it. That was Mark's idea. That's a great idea, Mark.
I'm here to add value in any way that I can. So.
Absolutely. And so then that way you can look at and again, this is one of their devices. And before we bring any services or treatments into Revitalize, we always research and are going to bring the best services that are available. So this is one that we use all the time, and Marissa will go into that specific treatment, but in the meantime, or at least what happens during the treatment, because she does them on a daily basis. And it is great at making people feel comfortable and educating them along the way. But RF microneedling is what we're talking about today. So Morpheus is one form of RF microneedling. So there's multiple different names that you can hear when you're talking about RF microneedling.
Correct.
Morpheus 8 happens to be one of them, and one of the best in our opinion.
One of our favorite treatments
We
here
like
that
to
we
think
use
the best.
often.
Well, the best, and one of our favorite treatments. But yes,
It was actually
Match made
the
in
first
heaven.
treatment I did when I started here.
Really?
Yeah,
Oh, well,
absolutely.
yeah. And you were trying to at that point treat.
Acne scars, and then also trying to tighten skin a little bit, because you get into your late 30s, early 40s, you start noticing a little bit of changes.
Yeah, nothing to notice. Don't worry about that.
Yeah, well, because I keep doing treatments.
Yeah, exactly.
Exactly.
Well, I would have never known.
Shiny and tight. So, well, if you've ever heard of microneedling, so microneedling is when we're using needles to create microchannels in the skin, and you're doing that with needles. And so what you're doing with radiofrequency microneedling or RF microneedling is you're driving energy into the skin with the needles, which are going to stimulate more collagen and elastin, and you can get lift in addition to tightening and all the other benefits. So
And resurfacing.
Well, yeah, and we kind of say, jokingly, it's or just microneedling on steroids. So it's you're going to still get that impact, into the skin, causing that micro injury to get that collagen elastin production going. But on top of that, the radiofrequency energy is what's causing it to give it that steroid-like treatment, in the sense that you're causing, that much underneath the skin, getting that tightening and lifting, but you're also treating fine lines, wrinkles, active acne, cystic acne, ice pick acne scarring, stretch marks on the body, which I know we're going to talk a little bit about later.
We're going to talk about stretch marks.
Cellulite.
Treatments for that,
Tightening the skin, true fat destruction. So I don't know if people getting injections underneath the neck right here for that little fat pad right there. You can actually fix those needles in and cause true anabolic change right there as well. So there's a lot of things that this, some would call it a magic wand, as far as aesthetics can do.
Yeah, it is one of the most popular treatments available in aesthetics right now is RF microneedling and Morpheus. And some other reasons why we use it.
Texture.
Research.
What do we see the most in our clinic? What are you using it the most for?
Acne scars and texture. That's what we're using it most for. We also get we help shrink pores. So anyone with texture issues, scarring, that's going to be my go-to. Also, if they have some mental fat here, I'm going to go to the Morpheus for sure.
Yeah.
We had one patient that said, I wish I would have known about this, right? Like I've needed it since the 6th grade or something like that to help shrink pores.
Yes.
Yeah, she was blown away
Shoulda,
after
coulda,
one
woulda.
treatment. Yeah.
She loved it. So again, whenever you're over the age of 40 and definitely over 50, frequently when we do an aesthetic consult in that age range, you're seeing hormonal changes, you're seeing skin changes, you start to see that laxity, and that's just loss of collagen and elastin in the skin. And so we need to stimulate it. And if you have not done anything and you're at the age of 40 or 50, you lose 1% of collagen a year. So if you start at age 40 and you come in because you see something and you want a little lifting, we already know that you're about 40% down at age 40. So definitely we want to go to a treatment that is it's usually done in a series that's going to lift. And so we have a couple different lifting treatments, laser or the RF microneedling. But we tend to really focus in on Morpheus when you have that resurfacing, texture changes, but you have anything in the way of fatty tissue that we
Jowling,
want to
yeah.
reduce.
That's huge.
Well, and people think of it as a surgical tool because it really is. I mean, you are going to get that remodeling, but it is a great preventative tool as well.
Oh, yes,
So,
yeah.
People starting at 28, 29, 30,
Correct, yeah.
why not? Because you're
No.
going to just bump that collagen elastin for that much longer.
Yes, absolutely. And so we definitely, and why we kind of start with that, because our patient population a lot of times is coming in saying they want a lift of some sort. You definitely need a treatment series
Oh, yes.
that's going to lift, and RF microneedling is one of the best services to do that. And if you have like a little fat you want to kill somewhere, then you definitely want to go to the microneedling, RF microneedling with Morpheus, because you'll get the lift and results.
And right now we're talking a lot about the face, but it can be used anywhere on the body.
Yes.
So we'll get into a little bit more of that with the body, with the stretch mark treatments and stuff
Yes,
like
yeah.
that. And
Scar revision. I'm not sure if we mentioned that
So
either,
scar
but
revision, yep.
C-section scarring or any kind of scar across the face, underneath the neck, you name it, really anything on the body. It is truly a great indication for that and just remodels the skin. And the reason you want to do that series of 3 is because that, like you mentioned, that collagen and elastin production, it's going to continue to grow on itself.
It's cumulative. yes.
Exactly. So from that first treatment to month, we say 9 to 11, that's when those results have become optimized. That's when all that collagen and elastin is produced on top of itself. And that's when you see that perfect, picture that we're looking for. And then, getting one every 6 months, every year after you've done that initial
As a
series
preventative
is
and,
great
yeah.
because we want to, gravity will happen or, things will happen that cause.
we continue to age, guys.
Exactly. So
Can't prevent that, not
to
yet.
continue
You still have
preventing
to
that
put
can really make a big difference.
Batteries in your watch.
Yeah.
Yep.
Well, and if you say you're losing 1% a year, so again, as Mark says, you don't have to wait till 40 or 50, but definitely if you're saying you want to lift, there's some stronger treatments you have to go to and in a series. Short of that, again, it's cumulative, but you're still, 25% down if you start at 25.
Yeah.
And so to prevent what you might see at 40 if you don't start young, then that is loss of collagen and elastin. So if you've not done anything to really stimulate collagen and elastin, then that's where you want to do RF microneedling.
Absolutely.
You're going to get
especially
great results with it.
in combination with good skincare, right?
Well,
so we've
and-
got to do all the base stuff too. Our daily regimens are so important. We talk a lot about that in combination with daily treatment, really trying to protect, right? And prevent.
Protect and prevent.
Marissa's always like, are you doing your retinol? Are you using this? Are you using that? What are you working on? Always trying to resurface.
Yeah, getting deep into the dermis so we can bring the newer, fresher skin out.
Yeah. Well, and if we're talking, so we always like to do everything comprehensively. So our aesthetic plans are comprehensive so that you can, get either preventative or you're doing a treatment series, but you're also combining that with other things to get the results, and skincare is one of them. And that's where Marissa's awesome at whatever your goal is and combining that to get comprehensive results. So if we were talking about specifically just anti-aging and preventative and young, and they come in and maybe have some textural changes, any scarring, when you do Morpheus, what kind of skincare would you look to, and do you prep them prior to any of your
Yes,
treatments?
especially in the different Fitzpatricks, you definitely want to make sure that you're prepping their skin very well with good skincare so they have the appropriate reaction to, unnecessary, so they don't have unnecessary downtime. When you do that, the skin is going to look fresher, newer, faster without any issues.
And look at Marissa's skin.
I know she has amazing.
Because every
skin.
time she's talking, we're always staring
staring
at her
at
skin.
it. I know.
And so, and we won't have her tell her age, but her skin doesn't tell it. Let's just put it that way.
Thank you.
And Morpheus is one of her favorite treatments.
It is.
And so we can actually kind of get into it a little bit because we like to be honest with everyone here as well. And so, again, there's never a painless procedure probably in our office because it always involves
And there
a
should
treatment,
be.
a laser,
Right.
a needle, an
Pain is beauty.
injectable, something.
We say it all
yeah,
the time.
Yeah.
I mean, it truly is.
So I mean, and that's just we're being honest. Like we'll tell you, what your downtime is going to be, what the pain level is going to be. But when it comes to RF microneedling, and in the interest of full transparency,
We have some of the best numbing cream and Pronox
That's
available.
step
And
one.
Pronox,
Yeah.
yes.
And me.
Cream and
Great.
Pronox.
And me and Meredith.
yes.
Absolutely. So not the most comfortable out of all the laser treatments, but definitely
is-
some of the best results.
It's well worth
so
it.
it's exactly. It's well worth it.
and we've never had anyone not come back for the full series because, and in fact, even if they were doing one and it's preventative, they come back. So
They love the results.
Love the results. It's well worth it, but it's not painless, and it doesn't matter what device you're talking about, what the name of the RF
Yes.
microneedling is. It's still going to be uncomfortable but manageable because, again, we'll use great topical and we have Pronox or laughing gas that we
Yes.
can use with it.
Yeah. Oh, and the way the energy is delivered with our tips versus, I guess, the competitors, it's going to be a little more painful potentially, but it's because the results are going to be that much better.
Yeah.
Like,
Well, and I will say, so Marissa and I have tried lots of different devices, and we sometimes will be here late trying different devices on each other, So we have been, we've had some others that we have tried with the selling point that it's less painful. And at the end of it, and the next day in a staff meeting, they're like, "So was it?" And we're like, "No, yeah, it was just as painful."
It was just the same.
Yeah.
Wow.
Without
So-
as good of results.
And I've done it without numbing cream once.
Yeah.
you're brave, but
And
worth it.
no laughing gas. So if I can do it and I'm the biggest weenie out there, you can do it. It's fine.
I
That
think
is
she must have
true.
had some alcohol on board because I really.
I mean,
I had
any
no
procedure,
alcohol.
Marissa's hiding.
Yeah, Marissa's
She's out.
hiding, and plus the numbing, the topical, and I don't consider myself a wuss, but it's uncomfortable, and I would not do it without topical. I'm just
Yeah,
saying.
no way.
So.
No, I wouldn't recommend it. I mean, I've seen people do it on the body with 4 millimeters of depth, full energy, but they just want the good results, and they're going to get it one way or the other.
yeah.
But you may as well numb if you can.
Well, and I think the body is still would be easier than the face. Honestly, I think that the face and you get around the eyes and all that is just a little more uncomfortable. But again, we can do topical. We have laughing gas helps tremendously.
Absolutely.
It's a great mental block.
Yeah. Oh, it's awesome. And so, and I don't like to do it without laughing gas. And again, I don't consider myself a wuss by any
no.
means, but that one, this
at
is,
all.
Let me add, I've never, ever used laughing gas myself when I've done Morpheus, ever.
yeah.
No, I'm not saying don't.
at you
I
right there.
highly recommend it. And I've done it without numbing cream, without laughing gas. So it
This
can be
is
done.
really
It's very
the first
manageable.
time she can come at me with anything. I'm just saying.
She's using the moment
because,
now.
But
She
she
is.
should because
Fully.
she's
No.
been very tough because I tried to talk her into the laughing gas and she didn't want to do it because of headaches, right?
Yeah.
But then again, I
Oh.
don't think it's at a level that she will. So I think we're going to try the laughing gas.
I will
on
try
her
it
at
next
some
time so I can
point,
tell
yeah.
you guys all
I've
about
heard
it
some
from my
providers will even
experience.
hang out and just take a little Pronox hit and go back to work after, right?
we have patients coming in that just want to purchase the laughing gas.
Hey.
Yeah.
So
I'm just here for
that's
laughing
another.
gas.
Yeah. Hey, we're getting an IV therapy. Can we get some laughing gas too?
For the
Yeah.
stick.
Yeah.
It's combination therapy.
But no, she's been a real champ with the RF microneedling. And if you're going onto the body with bigger areas, again, there's the potential that you can go deeper in those areas, but you can also do numbing that includes injections too in that area. So there's always ways to make it more comfortable, but we just like to be honest and say that it's not a pain-free procedure by any
No.
means, but well worth it. So
Absolutely.
Couldn't agree more.
yeah.
So one thing we didn't talk about, but we've kind of keep hinting on, is energy and depth. So what
Yeah.
exactly does that tip look like? How deep into the skin are we going? Kind of what does that look like for patients?
Absolutely. So I don't know. Did y'all grab the other tip? Okay, perfect.
Yes. Got
this
So
one.
if y'all want to turn that device on, we can actually see the needles come out. But briefly, with that specific tip, there's 24 different needles, and they are able to go to 4 millimeters of depth, all the way to a 0.5 millimeter. So on the face, you're going to target different areas with different depths of penetration to deliver that energy. On the forehead, you're going to be at a more shallow depth. And as you go down the face, you're going to get to a greater depth of penetration. Once you get kind of to the segmental area and we want to get that true fat destruction, that's when you go to the 4 millimeters and really zap the hell out of someone, for lack of a better term. But, I mean, what are your normal combinations there, or, what protocols are you using?
For the face? On the energy for the face, for the forehead is obviously, just like you said, lower. Anything that's thin skin over bone or cartilage or sensitive, I'm going to go down in depth, probably a 2 millimeter, and then a resurfacing step that's 1 millimeter.
Yeah.
That's the depth there. However, cheeks, I'll do 3 to 4, and submental area, probably 4, according to what I see. Every patient's different, but that's where I'm also going to change it. Not everybody, but a lot of people have a little extra fat here. So I can turn up the energy to probably around 50 and go deeper and really kill some fat there.
And there's actually a
and
mode,
on the fixed settings.
I was about to say,
Yeah.
you actually can fix those needles in and truly cause permanent fat destruction right there, which is, I actually don't think there's another radiofrequency microneedling device that can do that.
Yeah.
So it's completely customizable per
Well,
patient.
everyone's
Yes.
face is
By
different.
their-
Everyone's
yeah,
anatomy is different.
absolutely.
You need to be able to target different areas at different depths with different energy, and that gives
Exactly.
you the ability to do that.
So
And
it's
when
not
you-
a one size fits all.
It's not. There shouldn't be any treatment, I think, that's one size fits all, because
Very
there is
true.
no one size.
Yeah.
Exactly.
Well, and I think that even when we're talking about that and we're talking about fat destruction, the more that you stay, which is the fixed mode, the more that you stay and you're pulsing in one place back to back, the more energy you're driving in, the higher the temperature, and therefore fat destruction, where you really don't want to kill fat in the face. And so we're targeting fatty areas for fat reduction, and otherwise we're doing collagen elastin stimulation, resurfacing, making your skin thicker and healthier.
But you still want to keep that fullness of the face
Correct.
to a degree.
So that's where providers and experience matter. And so you want to make sure that you're going to somebody that's very experienced in the treatments that they're providing, because you don't want to kill fat in the face, but you do want to kill fat in certain areas.
Exactly.
You want to customize it for the patient, but also for what your target is. So
Correct.
definitely want to check, because your results are provider experience.
I was going to say it
Yeah.
is 100% depends on
Yeah.
who's doing the treatment
Yes.
on how good your results are going to be.
Yeah.
It's a great, treatment to have done, and let those patients that were looking at Botox and filler get through that first, the 3 Morpheus treatments, and then they won't need probably the same Botox they needed in the first place, or they won't need the filler where they thought they might have needed. But you're able to kind of complete that picture that you were trying to paint with some little touch-ups of injectables.
Well, and I almost say that, like, again, they'll still need all of that, because you want to, I get what you're saying, but I think I look at it more of we're going to paralyze the muscles so they won't get the muscle movements and lines, but they're always still going to have some lines present. So, like, if I look at Faraday's forehead, and so go ahead and lift up. So if she was lifting, now she only has like a little bit of movement right now. But if she had a line that was there and she didn't have any, I can't look at either one of them and look at lines on the forehead because they don't have it. And then, well, you got a little one maybe present.
I don't know what you're talking about.
I know.
Yeah.
Yeah. So if I see a line that remains, and I'm evaluating someone for the first time, if I can like thin out just with my fingers, I'm going to make that line go away with Botox. And if there's still a line, any
Like
line,
this.
fine line, anything,
Absolutely.
correct.
This one here.
Yes.
Even with
Like
any
right
kind
here.
of neuromodulator, it still is there, but it's a lot
So you can
better
see
with
where-
Morpheus. It was a lot deeper prior.
You can still see where there's that little indentation.
Yeah.
So like the fact that I can't completely make it go away, but it gets better. So therefore resurfacing and just sanding down over time, building collagen elastin will build it out. So like Mark has one up here.
Really
You know,
appreciate
like
this.
one line,
Yeah.
and it
Oh, yeah.
kind of still, it's still kind of there.
this
after,
is what we look at when we
Yeah.
talk to
Yeah.
you,
They didn't tell me I was
right?
going to be doing this when I came here today.
Yeah,
so that's perfect.
yeah.
But I will say,
And they
this has
didn't-
gotten much better with Morpheus.
Yeah, and that's
Much
and-
better.
And then you can get that combination therapy of the Botox or the
Yes,
filler on
yeah,
the back end to
yeah.
kind of complete what you've already started.
So I always just say, like, you're going to still need resurfacing. Like, so again, if they want any lift, if anyone comes in and they're like, I want this, that's a lifting. That you have to have an RF microneedling, something else that's going to lift, and a series of them, because that's a treatment and not just preventative maintenance.
Absolutely.
But if they still have lines and movement lines you want to paralyze, and you may need less, correct? But I think most of it's just like kind of sanding down in addition to muscle paralyzation.
No, that's a
So
great point.
I think I like both of them in combination because, again, it's going to prevent the lines, those little fine lines that are, he just
gotta
needs a little
hit
bit-
all of
Yeah,
them.
He
really
just
starting
need-
to think about it a lot
He
right
just
now.
needs a little Botox.
Marissa's
that's all.
over
I
here
like
and
that.
cocked and ready. Let's see.
I am
the
cocked and
machine.
You wanna-
Great.
you
I'm
wanna,
trying to
like-
give him like a little break
I appreciate
here.
that segue,
We're just gonna
Mike. That
take
was
the
really
focus off you
professional.
and
Yeah,
put it
thank
right
you.
on Marissa.
All
She's
right.
locked and loaded.
This is a 4 millimeter depth here.
So and you can use this in different areas. So even this one you can use, and I know this sounds painful, but you can use it on the body. You can use it back of the arms, on top of the knees, but
Hyperhidrosis
also
for under the arms.
yes, under the arms, but also like vaginal and,
rejuvenation.
and on the outside, it can tighten and make things more firm. You can show it again.
I don't think anyone at this table has been talked into that yet.
I definitely have not been talked into it. But
This is
Well,
1
we
millimeter.
definitely have some other options too that, and in fact, one of the machines, this machine
Two?
that she has right there,
Yes.
it's
that
one
is
of
our
them, but
women's
with
health
the
platform.
Votiva.
Yes.
Our
that's-
favorite.
our favorite.
3.
We could do a whole podcast
That's
on that.
cheeks.
We did do one that just briefly talked about it. We need to do
Submental?
another. Yeah.
But then we got off on a nipple tangent, so
Wow. That tends to happen.
yeah, there were all kinds of
All
tangents.
over.
Yep. Did you guys see that?
Yep, go ahead.
That's the 4 millimeter depth again.
Hmm.
That's usually what we use on the submental area or fatty areas or body. This is 3 millimeter. That's usually the cheeks.
So again, like we were saying,
You
not
got
the
it,
most
Ellen?
comfortable, but so worth it.
Yeah.
Forehead,
As
orbital bone,
the
nose.
providers, you always want to set those
Chin, lips.
expectations so they know what they're getting into. But
Absolutely.
it's not something where you're jumping out of the chair. I mean, from what
No,
you've
no,
seen,
no.
and with the proper topical numbing, whether that or also with the Pronox, it's going to be a manageable experience. And when you see the
Exactly.
results that you get after really, and I tell people only 24 to 48 hours of true downtime. Again, everyone's different. Some people might have a longer response time if you have more sensitive skin, but you can be putting on makeup or your regular skincare routine after 48 hours with no
Yeah.
problem.
Yeah.
So
Well,
I'm
glad you
super
brought that
sensitive
up.
and I need like a day recovery.
Which
and
is-
I
yeah.
light up for everything. For everything. For everything.
So, and I think but I think that's a good point to bring up is downtime because everyone wants to know downtime. And so there's very limited downtime. So even if she lights up, it's redness,
Yeah.
but still something you can go out with. You're not swollen and bruised. And all the bloody pictures like the Kim Kardashian vampire facial,
That's just right after.
that's a little drama too.
And there might be a
So-
little spot.
A lot of added
But
drama
because of
to
that
that, yeah.
RF heat, you're actually
Yeah.
going to be cauterizing. So
Yeah.
you won't have a like regular microneedle bloody face that you would
Right.
normally
No.
have.
Yeah.
But people just call it a windburn, a
Yeah.
more
It's redness.
severe windburn.
Yep, I get red. Dr. Durst has it done and like walks out and no one even knows she did anything.
Yeah.
It's the
Yeah.
craziest thing I've ever
Right to
seen.
happy hour.
Yeah, right to happy hour. Yeah, I don't hardly react with redness, and if I do, it's an hour or so. But you can also add PRP to these treatments. So
Which I highly
PRP
recommend.
is, again, platelet rich plasma. So we're drawing blood, we're spinning the blood down to get the platelets in a concentrated form of platelets because platelets have growth factors in them. So if you cut your arm, your platelets go, stop the bleeding, and regenerate skin on the arm and not somewhere else because it communicates, those growth factors communicate with stem cells in an area. So basically, on the face,
Same
if
exact
you're throwing all those growth factors in microchannels, so your healing is so much faster for most.
Just
And so-
optimizing
yeah.
recovery.
Yeah,
at the
and
end of the day.
your redness goes away faster. You
Absolutely.
get boosted collagen and elastin. So adding on PRP to this treatment is phenomenal.
So bottom line, if you're doing your face, you got to do your neck and chest, and you got to add on PRP, and then you're good.
And then you'll
Yeah.
start
Done.
doing body treatments.
Yeah.
It's,
And then
it's
we
really
go
a
on to the
slippery
next.
slope.
Yes, absolutely.
Which we'll talk about in another podcast.
Yes. Well, and you definitely always want to include the neck and the chest because
Always.
it's going to age women as we get older. And again,
That's what we see,
men
ladies.
need tightening as well in those areas, but that's what we see is we do things to our face, we don't to our neck and chest and
Face, neck, chest, and
hands.
Skin is
And
connected.
hands.
Oh, and hands.
You strengthen
But you
one,
don't
you
have to
strengthen them all. So do them all.
I don't know that like hands. I've never done the hands with the Morpheus, and I don't know that I would.
Have you seen
There's
that?
some other things you
I've
can
seen
do.
quite a few people do the hands. It's not the most comfortable.
Yeah, I was
I
going to
for
say.
Morpheus. And that's the one downside. I'd say it can get a little painful right there, but I've seen some awesome resurfacing
Yeah.
from that area.
Really
It responds
have to
really
need
well,
that.
especially with the PRP combination.
I definitely think add on your neck and chest to all treatments. I think hands,
Absolutely.
we have some hand treatments and some biostimulatory fillers that work well for that resurfacing too. Probably not as painful.
Yeah.
And so,
And I would say just think about the reason to conclude all three of those parts is think about every picture you're in. It's from here up.
yeah.
So you're going to want that full picture of youth and lifting to be synergistic. So if you have just your neck and your face and chest are like droopy or whatever it might be, then
Droopy and
that might have been
old.
the wrong word, but you know what I'm trying to say. But yeah, so you want to make sure you're
The opposite of tight.
Mark is very, I will
Decrepit.
say Mark is very smooth for a man. Like we could
Yes.
have other men on here and it would be, no, don't
be
say that.
worse,
No,
yeah.
no. Yeah, but no, you're doing a great job and he always is very, very well spoken
I
for a
appreciate
man in the
that.
aesthetic industry.
Absolutely. And well, Mark's going to hang out and do a couple more with us,
Yeah,
a little bit
looking
more
forward to it.
focused on some treatments. So
So yeah, stay tuned.
So
and-
stay tuned.
And watch for our stretch mark treatment with Morpheus. That includes Morpheus because again, not many ways to get rid of stretch marks. So make sure you watch that podcast or listen to the podcast or watch the video. So
do both.
yeah, do
Yeah.
both.
Do both.
So again, like, subscribe, hit the bell, be notified of any future videos. And again, thank you for listening or watching, whichever one you're doing. We really do appreciate that and boost in our, topics and channels. And again, anything else you want to talk about from an aesthetic standpoint, you just let us know. And please comment if there's any experience you've had with radiofrequency microneedling, Morpheus, PRP, anything else. And
Share with
otherwise-
friends.
Share with
Yeah.
friends.
Make
Otherwise,
your appointment.
Yeah.
Thanks
Yeah.
for having me.
Yeah.
293
Yeah, thank you.
5828.
Thank you, Mark.
Yeah,
Yeah,
we're
we're
not
not
done.
done, but thank you.
Yeah.
So again, just recall, we're here to revitalize your look, your health, and your sex life.